to keep your cameras off and your mics off as well, please. That would be great. Okay, so welcome to our UNISON Scotland Social Work Issues Group lunchtime webinar. We've been running these since lockdown 2020, and this is our 24th lunchtime webinar. And our aim has always been to talk about social work related issues with an emphasis on those that affect our members on the front line of practice. We set out not just to provide a discussion forum with expert speakers from academia, government and practice, but to offer radical and critical comments in line with the union's progressive policies. SWIG itself holds quarterly meetings and is open to delegates from all of the 32 local authorities. UNISON branches in Scotland, and as well as discussing trade union matters affecting our members, we're keen to look at broader issues and, when possible, pick up on messages from these webinars and to look at actions that might be required. People on this call will be familiar with certain terms that are not commonplace in Scottish Government policies and documents, even though just a few years ago we may not have heard of them all. Amongst these is the description of people who use services as having lived experience. In the trade union movement, we argued successfully for lived experience to include the workforce, and that is now generally accepted. Alongside lived experience is the concept of co-design, the idea that those with lived experience should have a place in working out what services are needed and then how they are delivered, and the concept of co-production. This is today's topic. And we have 3 speakers, and I'll introduce all of those properly just before they speak. So we have Rachel Dowell from the Scottish Government, Laura Stewart from Aberdeenshire Council, and Nick Kemp from the Commonweal Care Reform Group. There'll be an opportunity for all of our delegates to ask questions, and you can make comments in the chat box, and we'll be monitoring that as we go along. And if we've got a bit of time at the end, then anybody that wants to come in and make a contribution or ask a question or share views is quite happy to do that. Our seminars are always recorded, so we've started to record that, and they'll be available for a limited period of time on the UNISON Scotland website, and either myself or Irina will send that link out to everybody when that goes live. So with without any further delay, I'd like to introduce Rachel Dowell. Rachel is the Head of Strategic Design with the Office of the Chief Designer. This division provides training, guidance and support for teams to engage people meaningfully in the design of public services and manages design practitioners working in programmes across the Scottish Government Director General Health and Social Care. In recent years, Rachel worked with The Promise to develop the Promise Design School, a programme of training and support for organisations and those with lived experience working together to redesign services for children and families. She is currently supporting the Scottish Government and the health and social work partnerships across Scotland to co-design an adult practice model for health and social care. Rachel has previously worked in editorial and content design roles with a particular focus on making information accessible and inclusive. So over to you, Rachel, and welcome to the seminar today.
Thank you so much, Mo. Thanks. I'll just bring up my slides, seeing as you've done the introduction already, and I don't have to worry about doing that. Let's see if I can find them. Oh, you're the person I can see just now. Can you see the slides on the screen? Excellent. So I've just put them full screen there, so hopefully you should be able to see them okay. So yeah, in terms of that introduction, as Mo was saying, we as a division work across lots of different policy areas and organisations, and our focus is really about helping all the different parts of the public sector come together and work with people on, I suppose, what we would kind of term difficult public sector challenges. So obviously, some of those around the example of the Promise Scotland or health and social care programmes, and they're quite big, complex transformational programmes, and that's really where our focus is. I'm really keen to talk to you today around what co-design is, or certainly how we think co-design could be deployed into some of those spaces, and particularly on those public service organisational challenges. A bit of background around where this has all come from. None of it's new, and I think everyone will have their own kind of concept and thoughts around co-design, and some on the call may already have been involved in co-design programmes, and I'll be really interested in some of your reflections and thoughts around that. But I guess a lot of what I'll talk about, it already ties into lots of existing mechanisms across government, where the aim is really about how we improve and increase the quality of participation and decision making with people and communities about matters that are important to them. And a really important part of that, though, isn't just about that point around how do you seek people's views, how do you involve people with lived experience. It's actually how you get different parts of the public sector to work together. And I just wanted to put the image in there around the Commission on the Future Delivery of Public Services, or the Christie Commission, which was published a good few years ago, but people still talk about it. It still feels like something in some spaces that's quite aspirational. It really talks about obviously empowering individuals and communities, about involving them, but it also talks about the partnership across the public service providers and how they'll work in partnership, and how they'll work together to reduce duplication. And a lot of that could be done in those kind of early definition and commissioning spaces, and that's really where we're working. And the other images in here are really just about some of those levers. So we have a participation framework that's around how different participation approaches and methods we can use. We've got a Scottish approach to service design, which is around the kind of design framing for all of that. And that's the area that I'm going to focus on, and co-design is certainly a build on that. We also have Scotland's Open Government Action Plan, and we hold specifically an action in there around improving access to people with lived experience and service users and those who deliver services in the reform of health and social care services. So really there's a few different lenses that kind of come into this, which I'm sure is why there's lots of different kind of views and perspectives you can take to this. But the co-design approach in Scottish Government is really just building on all of that history and all of that aspiration around how we want to work. So I'll start with the definition around co-design, because it's actually the place where we start with any of our projects. And this is our current definition. You may have seen this already if you've been involved in some of those projects and programmes of work that I mentioned. It's framed very much as you would expect around what the design process looks like, because obviously we're the Office of the Chief Designer and that's our methodology. It really starts with that first part around starting with understanding people's current experiences, the current landscape, what's happening across the sector, the current perspectives, the current constraints, and all the issues in and around that, before you then move on into that next phase around areas that you want to take forward to kind of define what those future solutions might look like. And that's when you start to get into the territory of prototyping and testing those out before you commit to a delivery. But really the most critical part of the definition, I think, and maybe one of the more challenging parts, is around that partnership working. It's really around relationships and how you can bring people together to collaborate on lots of different issues, often very difficult issues, and to see that through to agreement on potential solutions. So that means staying in a space together, and often in quite complex spaces and difficult spaces throughout that whole process. And much of the work that we do in the Office of the Chief Designer in any early phase of the kind of the work that we do is actually bringing teams together to consider the definition and think about, you know, what sort of support mechanisms we need to put in to actually help this to happen. It may be reconsidering what the governance structures might be, and also where decision points are taken. And really always having that thought around where the resources and the time scales are around this stuff. Sometimes these are framed around, there may be legislative vehicles, other times there aren't, and they're much kind of broader in their aspiration, and these things need to be defined as part of the process. But really it's about trying to put those moments in to understand what we're working towards, and that we can communicate that clearly with people taking part, anyone who's taking part. I just wanted to flag the kind of the UN Human Rights Panel principles, because the really important point for us and the kind of the lever for us is around that participation element of it. And it's just that to kind of highlight the fact that when we're talking about participation, we're talking about making sure that it's active, free and meaningful. And a lot of that's around how we share that information, and a huge amount of effort for co-design to be successful has to go into making sure that people actually have enough time and the right information and the capacity and the accessibility to be able to take part of that process. And I think when we're talking about the resources needed to do this well, that's really something that's worth thinking about and planning in as much detail as can be managed, and being really mindful around that. A lot of effort goes into that process of making sure particularly information is being shared throughout, so that people feel that they can take part meaningfully, but also that they know what's happening throughout. I also wanted to share another quite complex looking diagram here, is just to think about the kind of the difference between co-design and co-production. That's something that comes up quite a lot. And the truth is they actually have more in common than they are different. The image on the left is a version of the ladder of participation, which I'm sure people are already quite familiar with in different formats. But it's really, the ladder participation really thinks about how people are being involved. So it's the kind of the way that they're being involved in any piece of work. So it goes right from kind of doing with and that equal and reciprocal partnership that I was talking about in terms of our definition, but right through to kind of just doing for. So maybe engaging people, maybe listening, maybe taking account of people's views, but going away and actually making decisions, right down to actually making a decision and actually telling people that this is what's happening. And it's really quite a useful way of thinking in terms of how you might plan and think about what level of involvement are you asking people to have, and how are you going to plan the work around that? And then the image on the right, again, quite complex and quite difficult to probably see on your screen, but it's and I'll share these slides, of course, but it's really about how we describe the two in terms of phases of delivery. So full co-production, you'll see that's kind of centered in the middle there, is about the kind of committing to that partnership working in the delivery of services. And for co-design, we're talking about defining what that service should actually look like. So it's an earlier stage. And sometimes that feels like a more appropriate way to look at it if we're thinking about things like policy development or our early phases of thinking about what change needs to happen, what areas do we need to focus on, and what should those services actually look like, and how can we bring organisations together around that before going into the kind of service delivery space. It's likely, though, when you think about it in that way, that co-production is a continuation from co-design, and actually there are significant overlaps between them. But the values are absolutely the same. It's really important when starting out in any of the projects that we do that we have those conversations and we plan that out to understand that people have a shared understanding of what these concepts are and the language means before even starting any work. Anyone who's worked in any sort of public service delivery will have had some involvement in terms of whether it's engagement, whether it's co-design, whether it's co-production. But quite often a lot of these labels are even used interchangeably anyway. So planning that out and having the conversations are incredibly important. This is one way of framing it. It's a way that it's been framed around the National Care Service Programme, and that's because it's been thinking about that legislative timetable. So it's just making people aware that these are the phases you'd work through. Another way of describing the stages of co-design is thinking about it in terms of that double diamond and the design process that we use. And I suppose what I'm trying to say by showing those two different ways of looking at it is that co-design will look different in different places, dependent on the scale and the size and the complexity of the work, and you need to plan your approach accordingly. This example is just showing that there are lots of different activities that take part through that entire process. And what we did with this was to think about when do we actually, where are those moments where you're coming together and making sense of all the information that you're generating, because lots of evidence comes out of these processes, and actually need to take the time to make sure that people are coming together and are able to actually make sense of information, understand what it means, and make decisions about what comes next. And our aim is really about making sure that people know where their input can happen, but also what's happened with what they've done today and where those decisions are being taken in the future. What I would say, though, is co-design can be really difficult and there are lots of challenges around it. There are always lots of system barriers in place, and I'm sure everyone will have lots of examples of what that looks like. But it just means that this, in terms of its maturity, won't happen overnight. So part of the tools that we're pulling together around co-design is around a co-design maturity matrix, and we're really keen to get this out into the wild so people can actually see this and input into it. But it's really about thinking about all the different elements of what needs to be in place for co-design to actually happen. It can't just be the kind of design process that I talked about. It has to be that people are learning and building capacity in how to do this. It has to be that the senior sponsorship is in place and that people understand where co-design is happening and where it's not happening, and also about the outputs of co-design activities, how they're being applied appropriately. So the matrix is trying to describe what good would look like in those different contexts. And give a series of kind of self-assessment prompts that teams can come together and create that shared understanding about how they want that work to happen. And we'll be really excited to share those materials and work on those materials with different groups in terms of how that might be useful for teams to help them improve their practice. Finally, I just wanted to say there's lots of different parts of co-design. There's lots of different methodologies that you can kind of apply to that in terms of the methods you want to take into your programs and your projects, but they all have similar hallmarks in terms of what good looks like. It's absolutely around communicating the opportunities around shared decision making and creating those spaces for people. It's about preparing people to be part of co-design projects, and that's not just people with lived experience, but obviously that is a huge part of it, but that's around organisations coming together as well. It's about relationships and allowing and helping people to be in a mindset where they can actually work together. And it's about taking the time to reflect on and improve as you go, because we never get these things right first time. They're often happening in really complex spaces. And it's really important that we take the time to think about what can we do better so that we can indeed kind of improve the kind of maturity of co-design in these different programmes of work. And I'm aware of time, and I could talk a lot longer, but I'm just going to say thank you, and I'll look forward to any questions you might have when we get to that point. Let me stop sharing the screen if I can. That's
lovely, Rachel. Thank you very much. If you could save your questions till the end, but you can put some in the chat, and any comments as well, you can put those in the chat too. Okay, so our next speaker is Laura Stewart. So Laura currently works in the Children's Rights team for Aberdeenshire Council as a Children's Rights Officer, and has had the privilege of supporting children and young people for the last 8 years. As a social worker who qualified in 1996, she's had various posts, starting in London in a children and families team and moving on to the voluntary organisations providing intensive family support, preventing children from coming into care, as well as working with charities such as Bernardo's, providing foster families with support and supervision. Being a children's rights officer is the best job that she has had, and as a social worker, it's meant supporting children and young people who are care experienced and making sure they have a voice, helping facilitate an amazing campaign group of young people. And last year, Laura took the lead in working alongside children and young people with child protection experience in developing and running a new part to their service, Children's Rights in Child Protection. And it's that part of children's rights that Laura wants to talk to you about today. So over to you, Laura.
Hi there, everybody. Thanks very much for that introduction, and thanks for the previous speaker, Rachel. Right, I'm going to try and share my screen. Can people see that?
Yeah, we can, Laura.
Yeah, brilliant. Okay, so I start from the beginning. Okay. So thanks very much for having me today to talk about the co-design aspect of me taking the lead in setting up the children's rights support and child protection part of our service. I wanted to talk about just a bit of context to the team and what I've been doing. So we're a small team in Aberdeenshire. We're 2.5 posts of children's rights officers, amazing children's rights officers, and we've got incredible admin support too. The main role in children's rights is providing rights support to children and young people who are care experienced. And this generally involves getting to know them and helping them with their views at the huge amount of meetings that are organised for them. The principles of how we work is empowering to children and young people. So we want to give them as much control in the relationship as possible, and we only work with them if they want, and we only share with others about is what they want. And we often say to the children and young people we work with, you are our boss. So it's a really empowering way of working. Our main legal and policy influence is the UNCRC, so the United Nations Convention of the Rights of the Child. And we're ensuring that children's views are heard by adults, as well as supporting their rights, like to the best education that they can and the best health support possible. But we'd always be bringing up an issue with their permission. But today I'm wanting to talk about the new part to our service, which was setting up this children's rights support and child protection that I took lead in. We were given half a post in the team, so it meant that my other workload was managed quite carefully. So I was able to develop and run this part of the service. And I want to use Lundy's model of participation to look at that in a bit more detail. So some of you might know about Laura Lundy's model of participation, and that's great. And for others, hopefully I'll be introducing a model that would be really useful if you're thinking about getting participation of lived experience. So because I'm a children's rights officer, to explore the voice aspect of this model, I went straight to the children and young people when I was given this responsibility. And I asked social workers in Aberdeenshire Council, children and family social workers, if they could get in touch with children and young people and ask if anyone wanted to speak to me about their experience so that they could help in setting up with this service. So I met with 11 young people in total, and age ranging from 5 to 21-year-olds. So kind of broad range, and a broad range from Aberdeenshire itself. And I asked them 2 questions. What was child protection experience like, and what would you want change to make it better? So the themes emerging from the children and young people that I spoke to was that their experience of child protection had been confusing. They didn't understand the process. It was scary. Some couldn't remember being invited to meetings, and even older ones didn't go to core groups or their child protection meetings. Even if they did go, it was really difficult to express their views safely and to be heard fully because professionals and family were present. So overwhelmingly, their views about what was happening to them, or their ideas even about what would make it safer for them, wasn't listened to. And so child protection plans hadn't been taken account of their views. And so the UNCRC Article 12 asks us fundamentally to make sure that children and young people have a say in all matters that affect them. And that wasn't being put into practice. So all of them thought that having someone just for them would have meant getting to know them. Someone who could help with their views and advocate on their behalf so that their voice really influenced the decisions that were being made about them. And they also wanted to know about our service at the earliest opportunity. So what they wanted was having someone help, and this is their words, having someone help us understand what is happening, help get our views, represent our views, explain to us what's happening, and for our views to be listened to and taken into account into plans and decisions, and someone independent and totally for us. So thinking about the space aspect of Lundy's model, I offered to chat to them on the phone fill in a form or meet them face to face, and all of them wanted to meet me face to face, but giving them that choice was important. So I asked them where they wanted to meet, and again, giving them choice where they felt safe. So it was a mix. Some wanted to meet within their family, some wanted to meet at the family centre, some wanted to meet just having a walk, or at school or in the cafe. So thinking about influence, it's really important that I was able to listen to children and young people, but be able to, for their views to influence the design of this service. So I wrote up their experience and drew out their themes, and I met with other children's rights officers in the network, the Scottish Children's Rights Officers Network, who already provide child protection support. And almost all of them that I spoke to only provide support once an initial child protection planning meeting has been organised, or actually even but only when they're on the child protection register. So having listened to children and young people, what they wanted was for them to know about our service at the earliest opportunity, and that meant at the very beginning of the child protection process. So it was really important for their views to influence the design. And for those who wanted to, some of them helped design a poster and a leaflet, and we did an avatar and a video telling children and young people all about our service. And to make sure that their views were absolutely being taken on board, what I needed to do was meet with senior managers and take this pilot to them. And we talked about agreeing that the initial referral discussion at the very beginning of the child protection process needed to be changed to include a discussion on whether or not a child or young person wishes to use our service. So that was really important that we got senior management backing on that. And with the children and young people who still wanted to, we designed a feedback form to give children, young people and adults who referred to help evaluate the 6-month pilot. So I sent the poster and leaflet and some schools out so that they could share that with children and young people. And it's also on our Social Work Council website and on our own webpage as well. So and anyone can make a referral. So I needed to continue to speak with children and young people about their involvement. Some were happy to share just their experience, others were happy to help design the leaflet, and some wanted to know what feedback was from senior management. So it's really important, I guess, that people can understand how important that participation is. It's not just something that happens once, it really is a process. It's not a one-off. I'm thinking about audience, so I wrote up the pilot, I checked it with children and young people who still wanted to be involved at that stage, and made the proposal to senior management, and I suggested the 6-month pilot. And I went round all the social work teams in Aberdeenshire, all the children and family social work teams, with a poster and leaflet and avatar and video explaining this new service and how it was designed, and expected at that point, the initial referral discussion would be a change of practice, really, because that's what our children and young people were asking us. So the pilot was really popular, and there was a really broad range of teams referring. The valuation from children and the adults referred was all really positive, and all wanted to continue. And what we found was that we were providing a really intensive support to the children and young people within child protection, sometimes weekly for a period of time. So we were really responding to the needs of the children and young people. But it was so popular, I was having to say no to some referrals because we weren't able to pick them up. So I had to go back to management with an evaluation report and asked for half a post more, because it was really important that the practical part of this service, that it was still being led by the children and young people and what they wanted, and knowing at the very beginning of child protection process was important for them to know about our service. So So what I learned, so really listening to children and young people means you are really trying to get it right for them. And I do think that the child protection, the way this has been set up, really has the core of children and young people's experience within it. But I would say, and I hope I've kind of explored, true participation really does take time. You know, it took months visiting children and young people and going to management and going out to social workers. So, and it takes a big commitment, and it also takes resources. You know, I had to go back and pester senior management about that need for a half a post more, so that the service could be run properly. And I'm really pleased to say that we have been given that half a post more. It's just in this last couple of weeks, I find that we've got funding for half a post more, so hopefully we'll be able to absolutely put it into practice. But I guess I just want to kind of express how important senior management, the need for senior management to get behind this idea of participation is really important, as well as the social work teams, so that we're really truly listening to children and young people, and it does take time and commitment. But hopefully, you know, I've been able to show that full participation does mean giving children and young people the power to change things for the better. Thank you.
That's great, Laura. Thank you very much. Our next speaker is Nick Kemp. Nick was a social worker who became involved in commissioning the design of services in Glasgow City Council before moving sideways to Scotland Excel, where he tried and failed to set up a national commissioning service for Scotland. Angered by the service design failures he saw during COVID, he wrote The Predictable Crisis, and since then he has convened the Commonweal Care Group. So I'm going to hand you over to Nick. I know Nick had suggested as well that he wanted to take a show of hands to see how engaged people on this seminar had been around co-design and co-production. So I'm going to let you ask that question, Nick, and we can have a show of hands. So over to you, so that you can do your bit. Thank you. I'm hoping we haven't lost Nick. He was there.
Yeah, I see him still there, but not as a picture.
Oh, there he is.
For some reason, it clicked me off. Sorry.
Oh, right. Okay. Well, just on your introduction, Nick, and I'd said as well that you were keen to do a show of hands. So I'm going to let you ask that question so that we can do the show of hands.
It would just be very interesting, I think, for the discussion at the end, if people stuck their hands up and if someone behind the scenes here could just count how many people have actually been involved in one of the co-design events, that would be great. I'm going to just talk about co-design and the National Care Service, because the Scottish Government has said that co-design should be central to the National Care Service. We've written a critique of that, and I'm just going to touch on that here. It's called Ready to Fail, and it is from the Commonweal Policy Library. So you can go to Commonweal and just click on that and read in a bit more detail. So I wanted to just say, take you through some highlights from that. The ladder of participation goes back to the 1960s, and it covers everything from market research to basically what I would say is to doing things with people, a sharing of power. And I think it's important that when we're talking about co-design, if co-design is to be meaningful, it has to be about sharing of power as far as people are able. So it's right at the top end of the spectrum. And what I would say is this is not something new for social work, right? In terms of social work practice, it's been around for a long time. It's what I was trained to do, right? And it was to help people, right, as far as possible, make choices and so on. So just coming to the National Care Service, we can say that conceptually, you can see that co-design happening at 3 different levels. So working from the bottom up, there's at the individual network level. So you're working alongside people to try and design services or apply them. And that works everything from a social worker getting together what we'd say a care package or whatever, all the way through to the individual care worker who might be talking to someone how they best spend their time, you know, what they want to do with their time that day while they have the support. So that co-design is at the individual, it's a whole, encompasses a whole range of things. It's then at the service level, so it's how that, and Laura touched on, how do you change an element of a service? And so it's about how do we get people involved in designing services alongside people. And then it's at the policy level. And what I would just say is here that policy, that's not just necessarily national policy, it's also could be local policy, right? So local areas may need to have different policies, for example, for services in rural areas compared to services in urban areas and so on. So I'm going to work now, if you like, from the top, that high level back down with just some thoughts on this. The Scottish Government's focus on co-designing the National Care Service at the moment has all been at a policy level, right? Almost all, it's been at the policy level. It's, in my view, it's been nothing more than consultation. It's a very extensive consultation, but it's not co-design. And that's illustrated, for example, by the Charter of Rights. There's a lot of talk about rights-based service, but actually what they've said is they're not going to create any new rights that are enforceable. All it is about, talking about how we communicate those rights to people. So I think it's extremely limited. And actually a lot of that policy stuff, it's been around for years. We've been talking about rights for 20 years. It doesn't make it happen, right? So it's actually been quite limited. And it's significant that what's left out of that consultation is as significant as what's in. So finance, for example, is completely out of it, and resources is everything. So the consultation is staged in a certain way. There's lots of events. Why I wanted to know if people have contributed to that is people contribute views at events. There's often very good discussions, but it all goes into a black box, and no one knows how it's going to come out. People in government are selecting how that comes out. And I think this is a crucial thing, is the consultation tends to be on an individual basis. So there's lots of individual views, depends on who's talking. And we've got no democratic ways of representing those views. For example, social workers being represented through UNISON, right? We haven't got structures to bring those views together and then resolve them. So the whole thing is it's a bit of what I would say, a bit of a scattergun research, and I'm not sure it's going anywhere, right? Rachel may be able to answer that, but certainly at the moment, it's very unclear how any of that consultation is going to affect the bill. So coming down to the local level, and I'll stand to be corrected about this, but at the moment, no one's really talking about what co-design of services would be about. I think it has to happen locally, right? And actually it's about commissioning. And where commissioning starts, used to be about, we used to start with people's needs, and we tried to work out what type of services were needed in an area, and that meant a whole degree of consultation and engagement with people. And as a previous commissioner, I would have to say we often didn't do it particularly well. It's, as Laura says, it's incredibly resource intensive, but we used to talk to social workers about what they thought services would look like. We used to engage with local communities, particularly because if you didn't, you'd always get the NIMBY view, we're not going to have that service here. So you had to engage with people. And what I think's now happened is actually commissioning as it was has been overtaken by procurement, and the whole procurement processes stop that sort of engagement with people. Because what you do is you design a service, you go to the market, and as soon as you've gone out to the market, right, you've got very little influence over what happens next. It's very difficult to enforce co-design then through contracts and so on. And I think it's very significant. What Laura said is she was working through a public authority. It's much easier to co-design services within public services and voluntary sector, who are rather than people whose ultimate aim is to make profit. So there's some unspoken things about co-design that's blocking it at the moment. So I'm going to, and what I would just say that in terms of services and local services, community social work has a crucial role. we need to be thinking about services that are there for collective need rather than just individual need, but everything's starting at the moment from an individual basis, right, rather than an area basis. And that leads to a lot of problems that Rachel referred to, like duplication and so on, because we don't have, and I suppose this will bring me down to the bottom level, work with a social work, down to the social work level, is the issue at the moment that we've got is choice is given a far greater place, right, than control. So in terms of commissioning and so on, what's happened is choice links to procurement. You have to procure multiple services to give people choice. It doesn't work, of course, because there are no services in lots of areas, in rural areas and so on. So talking about choice is actually the wrong thing to do, but we're being driven into a situation where there's multiple services rather than actually thinking about how people control things. We've been having some very interesting talks about self-directed support, and self-directed support was meant to be, to begin with, a lot of the philosophy was being alongside people, doing what social workers should do, working with people to work out what they need. But it's been turned into an incredibly bureaucratic process where actually it comes down to people's budgets, right? And how they decide to spend that budget, right? And that, I would suggest, just gets in the way of co-design, right? And it's one of the big barriers to co-design at a local level. And I'd just like to make one other point here in terms of resources. If we allocate resources via individuals in self-directed support, it makes preventative services, all the things that are really important, right, very, very difficult, because you need to allocate budgets for those things differently. And actually, so we need to be thinking about, instead of distributing money through individuals, right, which makes co-design very hard, distributing money down to communities based on need, and then engaging with those communities. That includes the people who use services, their carers, the wider community, on how best to create services that would work in that area. So in short, right, I'll say that we think that co-design would be a really good thing, right? We could empower people, empower change from the bottom up, right? So actually we get people involved and we drive change through that. But actually what we need to do is, if we're going to pursue that agenda, we need to be talking about all the things that prevent that happening at the moment in the social care system, and there's a lot that's preventing it. And actually, it's very good that Rachel referred to some of that in she talked about system barriers, I think. Is that the right jargon? But system barriers, a very good thing to talk about. Thank you.
That's great, Nick. Thank you very much. There's about 5 people on this seminar that have indicated that they have had some sort of involvement, but is there anybody else that maybe hasn't raised their hand so far that has had some sort of involvement in the co-design? No. Just moving over to John, have you been able to monitor the chat? Is there any questions or points that anybody